appears to be some confusion about what a Doctor of Nursing Practice degree is within our community, so I went out and asked its members.
I think the Doctor of Nursing Practice is the highest level of a nurse, just short of being a doctor.
The Doctor of Nursing Practice means that the nurse is dealing with the patient holistically, just not what ails them, but helps them mentally and helps them as a whole person in order to get well. I think it's important that they're caring and kind, and most of them are. But I also think that they perform at a higher level than a nurse, which makes them different than just a RN. I think it's important that they're knowledgeable in nursing and superior and kind and loving towards people. The doctorate of nurse practitioner should also help the person have a good recovery and follow through, take more time with them so that they can become healthier individuals.
So my idea of a nurse practitioner, what I think of when I think of a nurse practitioner is I think of somebody who, it's basically they have all the rights of a doctor, whereas they can prescribe a prescription, they can see a patient without somebody else. If you were to go to a surgeon or something like that and you had to have a follow-up, most likely they would have you see a nurse practitioner, because the nurse practitioner could then prescribe you medicine for pain or something like that. They could check and see if there's an infection or anything like that.
The Doctor of Nursing Practice degree, my knowledge, is someone that works alongside a doctor and is able to write prescriptions and see patients and help diagnose and treat them. I know that they are able to work to a certain extent under the doctor's care, but there's a fine line of where I'm not sure that is drawn.
The Doctor of Nursing Practitioner degree is a student or a person who is able to have the freedom to make decisions in regards to a patient's care and well-being, with the freedom to choose how they are handled by the nurses and give that recommendations to the doctor. The doctor may then have the final say on how the patient is treated, with the input from the nurse practitioner. The doctor doesn't necessarily have to see the patient anymore. He can go off the recommendation of a nurse practitioner and make that determination then if something else should be done, or completely follow the advice of the nurse practitioner.
As a student of Health Services Administration, I see doctors of nursing practice as an influential part of any healthcare system. They really have changed to be the primary point of care for a lot of patients and have really improved the quality of care that patients receive. So I think in the future that doctors of nursing practice will be an influential part of all healthcare systems.
I would like to thank all of the community members who agreed to be a part of this presentation. It is clear that the DNP role is a vital role in our community. Now let's take it back to the classroom for the rest of the presentation.